Sir.
Yeah. Hello, I am Dr. Madhu, surgical oncologist from King's Hospital, advanced laparoscopic and robotic surgeon in the field of cancer surgery. Here we am heading the surgical oncology department in King's Hospital. Today we are going to discuss about recent advances in the cancer surgery and treatment on the whole. Nowadays, the management of cancer has crossed milestones, giving the best cancer care for all the patients throughout the world. In India also, the prosperity of cancer care has gone to the sky. Most of the society is in reach for the advanced cancer care treatment from all organizations in India. In Hyderabad, we have around 8 organizations providing cancer care. Among them, KIMS is one of them. And regarding the recent advances for the surgical oncologist, there are many. Breast cancer management, there are many recent advances like sentinel lymph node biopsy, breast conservation surgery, oncoplastic surgery, and in the radiation field, intraoperative radiation and partial breast radiation. And in the case of medical oncology, many new drugs available as chemotherapeutic agents, hormonal agents. So with the evolution of all these options, the management of breast cancer has become much more meticulous. And most of the patients are getting cured. Rest of the patients are having long-term disease-free survival. In the case of sentinel lymph node biopsy, conservation surgeries, oncoplastic, these things are helping to reduce the suffering of the patient, morbidity of the patient, and those patients can have the survival that is equivalent to the patients who have underwent mastectomy. And in this sentinel lymph node biopsy, the lot of morbidity regarding the axillary dissection has gone down. Most of these things are helping us to increase the comfort of the cancer patients without compromising the survival. In case of thyroid cancer, we do scarless neck procedures. Previously, we used to give a scar in the neck to operate for thyroid cancer. Nowadays, patients who prefer not to have a scar in the neck are being offered minimal invasive procedures. It can be endoscopic thyroidectomy or it can be robotic thyroidectomy. In the case of robotic thyroidectomy, which we are practicing, we have many approaches. One is the transaxillary, that is from the axilla will be tunneling, and it is a gasless thyroidectomy. The other one is retroauricular. The incision will be given behind the ear and there won't be any scar in the neck. The other approach for scarless neck procedure for thyroid cancer is BAW, bilateral axillary breast approach. And true scarless procedure is transoral. That is, through oral cavity, we will be approaching the thyroid gland. So these are all the approaches which enhance the recovery of thyroid cancer patients without any scar in the neck. So cosmetically, these people will have a satisfactory outcome, and this is preferred by most of the young girls and boys before marriage. And in the case of thyroid cancer, there are certain chemotherapeutic agents, recent evolution of targeted therapies there, and in the nuclear medicine department, radioactive ionization. Some new evolution of drugs like thyrogen is making it possible to give radioactive radiation as early as possible. And in the head and neck cancer management, a lot of things are available, like lasers, which avoid scars, and for the cancers that are not approachable by open surgery, that is, base of tongue cancers, tonsillar cancers, and oropharyngeal cancers. This transoral robotic surgery. This is a revolution in the cancer care for oropharyngeal cancers. Previously, all these cancers we used to send for chemoradiation treatment, and the outcomes were not good. Most of the patients used to succumb. If at all we have to go for open surgery, we have to do a bone cutting of mandible bone and approach the lesion, which is a highly morbid procedure. With the evolution of this transoral robotics, we are able to reach the lesion with miniature instruments and excise the cancer with least morbidity, and the patients are doing well after surgery, with upfront surgery, which were having very poor prognosis in the past, now are amenable. So this transoral robotic surgery has been FDA approved, and it has become a standard treatment for oropharyngeal cancers. So, like this, in each and every cancer, there is evolution of treatments in many ways. And just now I commented about head and neck cancers. Let us go to other organ cancers like abdomen. We take esophageal, stomach, hepatobiliary, pancreatic, colorectal, all these cancers. All these cancers are used to be operated by a surgeon in the open method, though a decade ago. Now we adopted many approaches like laparoscopy and robotic surgery in the field of abdominal cancer. The cost effectiveness of robotics has been very well organized in our organization, just so that we are giving the benefit of robotic procedures to each and every patient at an affordable package. And especially the pancreatic cancers, which we operate generally for the head of the pancreas or body and tail of the pancreas. These procedures are highly technically demanding procedures. They require large incisions, which will cause a lot of morbidity in the post-operative period. In these cancers, we adopted robotic procedures, and the procedure which we call robotic people, it's helping a lot of patients recover faster and with the equally good oncological results. And for esophagectomies also, to do lymphadenectomies, this robotics is helping a lot and bringing down the morbidity. The critical care has gone down. These procedures have now become safe procedures, which were used to be having a lot of complications in the past. Not only this GI oncology and HPV procedures, uro-oncology, prostatectomies, partial nephrectomies. So robotics has created a lot of revolution. Actually, it started with prostate only. Uro-oncology, gynecology, all these cancers, robotics has made a dramatic revolution in the management of these cancers. And certain areas, definitely robotics has got advantage over labs. This I am explaining in view of abdominal, uro-oncology and gynecology as a general rule. For example, a patient is highly obese and the a lot of mental fat, bulky. These patients, the conversion rate compared for robotics and laparoscopy, robotics has got very less conversion rate compared to laparoscopy. Definitely, this robotics has made a revolution in managing all abdominal, uro-oncology and gynec oncology. The other advances, this concept of intraoperative radiation has been practiced for pancreatic cancers. Some patients who are not fit for surgery, full dose radiation is being given with less mobility and this rapid arc facilities. Evolution of the radiation equipments with less side effects are definitely creating revolution in cancer care. And if we go to the thoracic malignancies like lung, mediastinal tumors, in these patients also, compared to the open procedures, either thoracoscopy or robotics are definitely creating a revolution in the treatment of the malignancies in thorax. Apart from these, I just briefed a lot about different cancers, how they are managed with minimal invasive methods, and how we go for high-end radiation equipments to bring down the market. Now, I would like to discuss about organ conservation protocols. This has become a definitely taking the healthcare to the next level in each and every patient's suffering from a specific cancer. For example, in the case of breast conservation surgery, and in the case of carcinoma, laryngeal cancers, giving radiation is going to preserve complete larynx. And conservative laryngectomy means where we remove a part of larynx and the rest of the larynx is left out there. All these are organ conservation procedures. These procedures are being practiced in many cancers, not only for laryngeal cancer, breast conservation surgery, and in the case of this bladder cancers also, kidney partial nephrectomies, like many situations we are doing organ conservation protocols. And I would like to specifically mention some bone cancers like osteosarcoma of lower limbs. These patients are specifically treated with chemotherapy initially to enhance the tumor response, and later the patient will be subjected for limb salvage surgery, so that the patients who are suffering with bone tumors lower limb can go on without having any amputations, limb being removed. It's not being done routinely now. Most of the patients we are subjecting to limb salvage surgery. All these various amicabilities are available. And if we come to the chemotherapy, a lot of targeted agents are available for the management of each and every cancer, which is the domain of medical oncology, which I would not like to go in deep. And the radiation also, as I already explained, many latest radiation equipments are available. And surgical things, we already mentioned about the concept of robotics, concept of advanced techniques like sentinel node, organ preservation protocols, and these things have definitely made the patients more comfortable, and they are ready to undergo the surgical procedures with least botherings, and definitely taking the healthcare to the next level. Of all these things which I mentioned, these are all the things that are being practiced for treatment of the patients. Most important is prevention part. It is the utmost important for the society to be aware of the cancer diagnosis, possibilities of cancer. Probably by having some symptoms, this patient may have a cancer. That kind of awareness should be created through media or through educational programs or through online advertisements, all these things. Not only that, regular conduction of screening camps so that most of the patients will be picked up during the camps early, and the regular examinations, consultation of nearby specialists or concerned doctors. This is going to enhance the pickup rate of the patients with cancer. And if the patients with cancer are detected early, means they're going to have a complete cure if they are started treatment early. Suppose the disease gets delayed in its diagnosis, presents in the end stage, the treatment will be not be having a good response, and patients, most of the patients will be losing them. It's always better to diagnose the disease early by creating awareness among the patients, among the society by conducting continuous cancer programs like as I mentioned, screening camps, walks, promotional programs through media, and regular interaction with the concerned specialists, regular health checks. All these protocols, if they are implemented on a regular basis and if we keep the system active, the society will come to know earlier, and then there is a high possibility of the disease getting diagnosed early. Thank you. Any questions? These are some questions being uh, raised before me by certain patients. The first question I want to read out: do we get cancer from what we eat? It's a very nice question. The source of cancer most of the times will be from our food only. The food habits are very important. Certain foods it is better to avoid, like fried foods, pickles, the oil we use, and the foods that are being preserved days together, that is being eaten the next day. All this should be avoided. And it is better to bring down the consumption of non-vegetarian food weekly once or twice. Vegetarian foods consumption is better. And it is always better to avoid rough foods, eating rough foods. And chili consumption should be brought down, especially green chilies. Chili consumption should be brought down. And this food adulteration has to be controlled by the government to improve the general well-being of the society and bring down the incidence of the cancer. So definitely what we eat is going to contribute to the incidence of the cancer. So whatever we eat, we should be conscious of that, what we are eating. Better to avoid certain foods to be healthy. So eat healthy to stay healthy. Next question. Are chemicals and pollutants causing cancer? Yes. Pollutants like the exhaust from the vehicles, heavy vehicles, and the chemicals that are being exited from factories, these are really dangerous. They are going to cause many lung cancers and professional related cancers. In the case of most of the times, male patients. So it is better to bring down our exposure to pollutants and chemicals, or else there should be strict norms to bring down the pollution of the environment and the proper disposal of the chemicals to reduce the human exposure. Next question is, does cigarette smoke really causes cancer? Yes, cigarette smoking causes cancer. The smoking is being evaluated in many cancers as an etiological factor. The first cancer which we, as soon as the smoking word comes, lung cancer. But there are many cancers that are related to smoking, head and neck cancers and abdominal cancers, some urological cancers also described. It's always better to quit smoking as early as possible, better not to get addicted, and people who smoke need really psychological counseling to uh, leave that habit. It has been proven risk factor for many cancers. Best is to quit smoking, be healthy, and free of these certain dreadful cancers. Can cancer be prevented? That's what we discussed now, like having a healthy food and preventing exposure to chemicals and pollutants, quitting smoking, alcoholism, avoiding some pan, gutka, all these habits, and certain drugs also should be avoided. Many things. If we take proper precautions, avoiding all these things, most of the cancers can be prevented. And these are habit-related and professional exposure-related cancers, which can be prevented if we stop exposing us to them. So can cancer be prevented? Means yes, certain cancers can be prevented. Why does the diagnosis seem to be so delayed in so many cases? So we have seen many patients coming with advanced presentation, diagnosis getting delayed. It can, most of the times, diagnostic delay is due to lack of awareness in the society, proper lack of awareness, and even suppose if the awareness is there from society, sometimes from the contribution from medical field, or sometimes there may be some delay. So overall, if you improve the awareness, this diagnostic delay can go down, late presentations can come down, and the management of the cancers quality will be better. Next question. I am going to start radiation next week. What should I expect? What can I do to decrease the fatigue? So, see, most of the times radiation causes a lot of fatigue that will be managed by giving multivitamins and improving the nutrition. These two things are going to help these patients. How does fatigue affect a person? Most of the times, this fatigue is going to change the scenario of a cancer patient. Their immunity goes down. So many things have to be addressed. Nutritional upliftment and immunity boosters. These are going to improve the immunity of the patient. And as soon as that improves, the fatigue goes down. Can a change in the diet alter the course of the cancer? Definitely. I can't say it's going to change the course dramatically. Certain effect is there by consuming food with antioxidants antioxidants are, suppose, high, like watermelon. These things are going to help us to a certain extent. What extent I can't tell, but certain benefit is being described. By changing diet, that is going to change the course of cancer. Will there ever be a cure for cancer? Already the cure is existing for many cancers. Definitely the cure is existing for many cancers, like breast cancer, thyroid cancer, head and neck cancers, colonic cancers, lymphomas, like that. Many cancers, some testicular tumors, even for kidney cancers, cure is available. So, you should not feel that there is no cure for cancer. Will my hair grow back? Most of the times, chemotherapy related hair loss will be there in case of breast cancers and ovarian cancers. But in the case of breast cancer, the hair growth can regrow. But in case of ovarian cancer, the growth of regrowth of hair is less. So it all depends upon the which cancer is being treated and what are the drugs that are being used. If I have a lot of side effects, does that mean that chemotherapy is working? Chemotherapy is working, but presence of side effects is not going to determine the effectiveness of the chemotherapy. The side effects may be varying from one patient to another patient, the volume of the side effects. So that doesn't mean that chemotherapy is working. Chemotherapy working means we see for the response of the tumor, not based on the side effects. Are the side effects of chemotherapy worse than the cancer? Sometimes the side effects of chemotherapy are very immense. Patient can't tolerate those side effects and they quit taking treatment. But most of the times, these side effects can be managed. Most of the patients tolerate. If the benefit versus side effects ratio is more for benefit, we should continue the chemotherapy even when the patient is having side effects. Does everyone with cancer get anemia? Most of the cancers will cause anemia. And this can be corrected in many ways, like iron supplements, blood transfusions, growth factors, many things. But anemia is most of the time the common denominator of cancer patients. Why don't I get anemia right after my chemotherapy? Most of the patients with chemotherapy, there will be the side effects will be regarding the infectious complications compared to anemia. So those things come under the domain of medical oncologists. They will be a better person to explain the management of side effects after chemotherapy. That ends the questions. Thank you, everyone. Thank you. Thank you. Overall,